Insomnia disorder is a complaint of poor sleep quality or quantity. So patients complain that they do not fall asleep quickly enough, or they wake up a lot of times during the course of the night, or that they have a diminished sleep amount, or that they wake up feeling unrefreshed during the course of the day. Insomnia disorder also has a frequency assigned to it by the DSM-5, which is the most commonly used nosological classification for insomnia. It has to occur at least 3 nights per week, and has to occur over the course of 3 months or longer to be defined as a disorder. Plus, it has to have consequences. In other words, people who don't sleep well need to have some degree of impairment during the course of the day, or have to be concerned a great deal about having the problem. Now, some of the consequences of insomnia, for example, include things like motor and coordination, memory decrement during the course of the day, falling asleep during activities of daily functioning, and more dangerously while driving, and so on and so forth. So these are some of the impairments that patients have to complain about to qualify as insomnia. And finally, what's interesting about the new nosologic classification of insomnia is that we no longer look at insomnia as being a primary or secondary phenomenon. We now look at it as being a problem or a disorder which coexists with other disorders or is comorbid with other disorders. So we're used to saying insomnia occurred because of this problem, because of that problem. Now we say insomnia is comorbid with depression or gastroesophageal reflux or with sleep apnea. And the reason for that is that data have shown us that we don't have a good way of establishing causality between insomnia and these other conditions. So for example, a patient has major depression could have depression and insomnia, but it's very possible that the relationship between insomnia and depression is a circular one, where depression causes insomnia, but insomnia then makes depression worse. So really you have the existence of 2 autonomous conditions in the context of one patient. So we now refer to the insomnia secondary primary phenomenon as being insomnia comorbid with these other disorders.